All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're going to be talking about robotic hip and knee replacement surgery this evening with orthopedic surgeon Dr. David Padden. Dr. Padden, welcome to the program. How are you doing this evening?
I'm doing great, Dave.
Thank you, and thanks for joining us. I always say on this adventure of health because we always learn so much. And I know I've had you on, about 6 months ago, and we talked a lot about, but I changed a little of the format today because I want to really, make the point to the listeners and viewers exactly what robotic surgery is. And because there's a little bit of a stigma out there like, oh, is the doctor doing the surgery or the robot? But this is robotic-assisted surgery. Dr. Padden is in total control of the Mako robot. So I just wanted to get that out there. So, Dr. Padden, like I said, welcome back. So tell us a little bit about robotic-assisted, minimally invasive. Let's start with hip surgery because that's a little bit more I know of than the knee.
Actually, truthfully, they're both similar. So let's break it down exactly like you said. There's a lot of stigma associated with robots and what they do for us in surgery, particularly. And there's also part of the reason behind that is there's been a very wide use of robotics in other specialties, such as urology and in GYN, where they use another kind of robot called a Da Vinci robot. So for those out there listening, I am not talking about a Da Vinci robot. That's a whole different kind of robot of which I am not an expert in, nor do I know exactly how that robot works and performs. What I can tell you is our robot is basically, I could describe it as this. What I'm able to do is I'm able to plan carpentry out in 3 dimensions, position and place implants, meaning something on your hip bone, whether that be on the femur bone or in the pelvic socket, or whether it be in your knee, on your femur, at the end, distal femur, or on the top of your tibia, which is what a knee replacement is. We also resurface the patella. But I'm able to actually position these components virtually on a computer before we ever start the procedure. That's based on a CAT scan that we obtained. That's a specialized CAT scan. It's not one that requires all the radiation of a standard CAT scan that's done, let's say, if you had a problem with your abdomen or your pelvis or things like that. And off of that CT, we're able to create a 3-dimensional representation of your exact bone, its positions, dimensions, etc. We're then, again, able to position these things virtually. In a hip, that's all we do. And then in surgery, the robot helps me perform the carpentry aspect. In the knee, we're actually able to adjust in surgery the components to maximize your knee's range of motion and stability, right? Because we have to achieve 2 things. Your knee's got to be able to bend all the way forward and backwards, and it can't flop around, wiggle like a fish, right? It's got to be stable under your leg. So we're able to make small, little, fine adjustments virtually on the computer with the input we give it based on ligament tensions, and then essentially the robot then helps us do the same exact thing in a hip or a knee. If you could imagine if you had a drill in your hand, and I asked you to drill, let's say, into this piece of table right here. Okay? It's being bought right there.
Yep.
And I want you to drill at 40 degrees in the south direction and 10 degrees tilted east, and I want you to drill exactly 8.2 millimeters and stop.
I wouldn't be able to do that for sure. I'd be all over the table.
I wouldn't. Nobody can. Okay, and that's really the way carpentry was done for us in surgery prior to all this. So we kind of judged where we cut your bone, either using our finger or maybe a ruler. We don't have any exact points where to start or stop, so those were all very precarious, right? When we were putting your socket in your hip, we basically eyeballed. About 40 this way and 10 this way, and you hammer till you feel like you're at the stopping point and you're done. Now, with a robot, my carpentry equipment, so my saw or my drill, is attached to the robotic arm. While I'm drilling or sawing or putting the prosthesis in, I'm looking up at the screen, just like I'm looking at this screen right now over here, right?
Okay.
And instead of me looking down at what I'm drilling, I look at a screen. And the screen gives me every single piece of that information I just told you. It shows me exactly what angles I'm at. It shows me via color representation how much bone I'm removing. So initially the bone screen that I need to cut or remove. As I start cutting or drilling it, it goes to white. If I go a little teeny bit too much, it'll warn me. If I try to go even a little more, it'll give me a little feedback and start pushing back. If I said, the heck with this, I'm just going to keep going, it actually will shut off within 1.2 millimeter. Or if I try to move my hand way out of the angle that I wanted to do, it'll lock up. It won't let me do it.
That's amazing.
So it's really, really helping us perform carpentry to a degree of accuracy and precision that was not even close to available before this. You know, this is your body. This is a joint. This thing's got to last. It's going to take a lot of high demand. It's got to be perfect, or at least as close to perfect as we can humanly get it at this point. And so really, there's no really good way of doing this without that. You know, I did my fellowship at Johns Hopkins with the guy, Dave Hungerford, who developed all the jigs and devices that allowed us to do a total knee replacement that's done today manually, meaning manually means people without a robot. There are a lot, and I studied and trained with the man. I know the limitations of those devices as well. They are also not perfect. They're as good as we had at the time. But we have lots better ways now. And I would submit to you, there's very few things in the world that we do exactly as they were designed in 1970 or 1960-something. So I think that's a really exciting thing to be able to use robots. I think, you know, I use them now on every total knee replacement I do. I use them on every total hip and have not done them without a robot on a total hip since 2011. And I do a fair number of partial knees with the robot as well. So there's really nothing that I utilize or perform that can't be done with a robot. Big, small, you know, skinny, little, Chinese, Asian, Puerto Rican. Robots don't care. There's no prejudice. We don't care. We can perform it. The harder the case or the more difficult the deformities, etc., the better the robot is at telling us where we need to be, especially when the visual landmarks are so distorted. That's where these things really excel.
That's a great explanation, Dr. Padden. Again, Dr. David Padden, orthopedic surgeon, a robotic hip and knee replacement surgery specialist. I'm going to jump to a question I had way back. But so I had heard you talk about this in the past. So you do it's a muscle sparing technique where actually, is it you spread the muscle and fibers away to get to that hip joint? Let's stay on the hip first. And then
so actually in the hip, we don't have to spread any fibers. So I do almost all my patients laying on their back, supine, just like they would normally be. I make an incision on the side of the hip, and then I slide right anterior in front of the hip muscles, and I'm able to do the whole hip replacement without actually cutting or having to cut in between a muscle or cutting a muscle off the bone and reattaching it. That's a big plus for patients because the recuperation's a lot quicker. There's a lot less precautions. You know, the precautions used to be a real killer for a lot of patients in the past. They couldn't bend over, they couldn't cross their legs, they had to sleep on their back for 3 months after surgery. You know, a lot of people, that's not the way they want to.
Yeah, quality of life. They had to change their life around.
Right, and so, you know, we can get these people back more quickly. There's less things that need to heal. The knee replacement also, on most knees, other than the real significant deformity where we need a little more exposure, I'm able to then also go, like, as we said, in between a muscle and as well not have to go up into the quadriceps tendon, less overall pain, less overall difficulty recuperating.
Less hospital stay.
Hospital stays really nowadays really very minimal. Most people either will go home the day of surgery for a knee or for a hip or a knee the day after surgery.
That amazes me to this day.
Yeah.
Because I have family members, it seems like not too many years ago, who had these types of replacements, and it was a lot longer, but it wasn't robotics either. So
it wasn't that long ago. You're right. Only upwards of 7 years ago, people were routinely staying at least 3 to 5 days.
Yeah.
And 20 years ago, it was upwards of 7 to 12 days in a hospital. What a nightmare that would be.
Yeah, that's unthinkable nowadays. So again, here with Dr. David Padden, has an office with Tenet Florida Physician Services in Boca Raton, 9970 Central Park Boulevard North, Suite 400A, right on the campus of West Boca Medical Center, where you do this robotic surgery with it's called the Mako robot for short. But you do it right there at the hospital, and your office is right there on the campus.
Yes, and I also have an additional office down in Fort Lauderdale, just west of 95. You can't get any more close to it.
Yeah,
it's
right here.
in the Strayer University building, and it's a beautiful office over there, and I share that with a couple of other really great surgeons, Dr. George Caldwell, Dr. Mohideen, and Dr. Kenya.
Nice. Yeah, that's 2307 West Broward Boulevard, Suite 200, Fort Lauderdale. Numbers 561-430-4610 for both offices. And the website is drdavidpadden.com. It's drdavidpadden, Padden.com. Let's take a quick break. On the other side, I have a unique story that I'd like to share about the umpire that you helped get back behind the plate on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We're back on the You and Your Doctor show, living a longer and healthier life. So again, here with Dr. David Padden, orthopedic surgeon, expert, but robotic hip and knee replacement surgery specialist. Before I get to the story about the umpire, I wanted to ask you, who's a candidate for this type of care? Age, male, female, of course, probably both. But is this more for, what I'm getting to is more for our arthritic ailments?
Well, for anything that needs a joint replacement.
Okay.
So that would be certainly arthritides, certainly people who have had post-traumatic arthritis, whether that be through car accidents, other injuries, septic arthritis from infections when they were young, or other aspects. Of course, people can develop all kinds of bone diseases and inflammatory arthritides as well that will affect their joints and might require them to be having joints at an earlier age. And that's sort of what you're alluding to is, back in the day, we wouldn't be having this conversation other than with 70 and 80-year-olds. And today, the potential discussion of joint replacement can come for patients as young as 20s and 30s, given the appropriate scenario, etc. You know what I'm saying? So I may not make you live longer, or I might not certainly change your habits and make you live healthier, but I can certainly probably make you move a lot quicker and be a lot happier with your quality of life and pain control.
There you go, quality of life, which will actually help people live longer. Because if they're happier, they're probably going to live, a bit longer as well. I hope so. We hear that a lot on the show with the doctors. So, I'm getting to the story. So this was a retired firefighter who, very active gentleman, played tennis virtually every day. And he became a Major League Baseball spring training umpire. I know he did a lot of high school playoffs and even FAU college. So he did a lot of umpiring. He told me he had a bone-on-bone grind before, and he talked to, well, actually, you talked to him first because he was your patient. But when I interviewed him, what I'm getting to, he said he had a bone-on-bone grind, and it was very painful. So he had the robotic hip surgery with you. He told me he was out. He had it down to the minute. He only spent 23 hours in the hospital, same day. Right. He left the same day, and he liked you so much in the work you did. He had his other hip done with you, which was an ailment as well. So, and then he was telling me he was back on the court tennis. He said you said he could go back in 2 months, and that day he played tennis. Yeah, that story just amazed me front to back, and he sent me a picture of him umpiring again.
Well, you want to hear the cooler thing about all that?
I was all over the place with that one. Sorry.
The reason I met him was because he was referred to me from a guy who came down from Orlando to have me do his hip years ago when I was at Holy Cross, and then I did that gentleman's hip, and then when I left Holy Cross and I had to do my 2 years of penance away, I was up for a year with a buddy of mine in Orlando, and the gentleman whose hip I did from Orlando moved down here to Jupiter, and he met this patient, the firefighter, and told him, you got to go up and have this guy, whatever, do your hip. So he went up to Orlando, and I did his first hip robotically up there. And then when I came back and moved here and came back and started practicing back again in my good old West Boca and with Tennant, David came and had his hip done, the second hip over here with us, and had a great, of course, experience. And now I just literally saw him Thursday.
Oh, great.
And he's doing amazing, and, he's doing the umpiring and all that, and loving life and
tennis. He plays a lot of
tennis. Yeah, 3 days a week, and just the guy's back to being himself and having a great life again. And he's worked hard and deserves it, right? He was a firefighter, slaved away for all of us to keep us safe and keep our homes.
Yeah, I think he's a firefighter in Fort Lauderdale. And, if you're interested in that story, it's on Dr. Padden's website, drdavidpadden.com. It's a great story, in my opinion. It
could be your story, too.
Yeah, it could be. And then after I read that story, I watched a Major League Baseball umpire, because I've watched baseball my whole life, but I watched it for a whole game. That is very strenuous activity, and for him to go right back to it with no issues is just amazing to me.
Yeah, I mean, actually, you're right. They do a fair amount of squat, not full squats, but definitely some squatting down. We were actually talking a little bit about it the other day. His level of squatting is different based on players' heights. He's a really tall player. He has to stand up higher to get the strike zone more in his eye view. But, how it works, Dave. You played ball just like me. The umpire doesn't stand there. I mean, he's running when the when the batter hits the ball, too, to some degree.
Definitely.
Following in case, right? Because there are things that happen. Other umpires get pulled away sometimes. They're all backing and moving. It's not a stand in one position game. So, yeah, it's fantastic. I love it.
You need that kind of mobilization to be that kind of umpire. And same with tennis. I mean, watch a game of tennis, or a match, I should say.
Oh, yeah.
And it's just the way you're going to kind of slide into some shots in some ways.
And also there's a lot of rotation, and that's really where the hip, a bad hip, you can, depending if you're a lefty or righty golfer, you can, lay off. If it's your left hip and you're a righty, it might not hurt you for a while. But if you're a righty and it's your right hip, that's the rotation, just like baseball. That'll kill you, or golf or tennis, where you have to rotate a lot. When your bones don't rotate anymore, pretty much puts you dead in the water. So that's where that really can open up a whole new world for you. And, of course, tennis also, I mean, I'm not telling you that after we do your hip or your knee, we want you to be playing hardcore advanced singles ever again. But certainly you can see, what was the British fellow?
Andy Murray.
Andy Murray he's playing doubles now. Played in Wimbledon, right?
I saw he's playing in a tournament in the U.S. Yeah.
So it's possible. Again, they're not really designed to take the strain of heavy duty, a.k.a. Bo Jackson, who had his hip done 4 times, because, pro baseball is a little bit of a hardcore on your body, even though most people would think the baseball players might be the least physical of all the athletes. It's plenty of physicality involved.
Sliding. There's a lot of going
running,
on.
Swinging a baseball,
the turn,
and all that, in the outfield, etc. You can't be a hacker athlete to play at those levels.
Well, when you're watching a Major League Baseball game and it's a great hit, they always talk about that hip turn that Padden made,
Yeah.
Look at how he rotated his hips there,
And it takes, they're doing it in split seconds, right? It takes 1/10 of a second before you have to make your decision.
Yeah, much faster than we thought.
Like when you're going to swing, and to be able to generate that kind of power and momentum is incredible, right?
We got about 2 minutes. One more question. So is that typical for the robotic hip replacement? 2 months of recovery and then back to quality life, or was that a little fast?
Well, no. I'd say it's about the first 4 to 6 weeks are where you're really, putting up the healing and the implants growing into the bone and your thighs getting.
And then.
But after that, sorry about that. After that, the sky's the limit. So within the 6 weeks to 12 weeks, everybody's different. Some people are flying around playing golf and tennis within the 4 to 6. Others, it may take good 12 weeks or so. So I'd say 3 months.
Same with the knee?
The knee's about the same.
Really? I thought the knee would have been longer.
You're up and walking right away, day one. We get you up that day, whether you have a hip or a knee. And hopefully you walk out the hospital the next day, and then the first week, 2 weeks is a little bit rougher, and within a month to 6 weeks, you're bending and moving great.
Hard to believe we just got less than a minute left. I want to give out your info again. I tried to nail it, but if you have any questions, call Dr. Padden's office. You got any questions about insurance, etc.? Is it covered? You know, any questions for Dr. Padden? Again, it's 561-430-4610. It's drdavidpadden.com, David, Padden.com, Boca Raton office, Fort Lauderdale office. Dr. Padden, we'll have to have you on again. I love having you on and talking about, you know, robotic hip and knee.
Absolutely. My pleasure.
Thank you. We'll see you next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV.